Hi, I'm Tracer Foster, a home health agency business consultant. Welcome back to the Home Health Agency Administrator Training Program, Module number 9. And congratulations, you have reached the final training module. Today, we'll focus on how to measure success, conduct internal audits, adapt to industry changes, and develop strategic plans for long-term growth. Tracking key metrics and regularly assessing your agency's performance ensures high-quality patient care, regulatory compliance, and financial stability. So let's start by identifying the critical success metrics in home health care. By the way, every time you call a meeting with your team, be certain that you are keeping meeting notes, include which employees are in attendance, and who is assigned to complete any tasks for follow-up. Keep these notes in a binder, and your next meeting should pick up where this one left off. So how do you know if your home health agency is thriving? Measuring key performance indicators, or KPIs, helps you track progress and identify areas for improvement. A good time to have these meetings is after you have closed out your most recent payroll period, whether that be every week or every 2 weeks. That's up to you. In these meetings, you'll be reviewing patient outcomes and satisfaction, which includes monitoring hospital readmission rates, when they are coming home from the hospital, patient recovery times, satisfaction surveys, and how many discharges you may have and why. Next, you'll measure caregiver performance and retention. You'll track staff turnover rates and why, training completion, and patient to caregiver ratios. Also, don't forget your regulatory compliance. Ensure timely documentation, adherence to HIPAA laws, and adherence to Medicare, Medicaid, as well as other state regulations. Also, know your numbers, your financial performance, assess revenue cycle efficiency, claim denial rates, and billing accuracy. As the administrator, you may have someone handling this for you, but you should be involved or at a minimum sign off that the numbers that are handed to you are correct. You are responsible for this money. And again, it's up to you to know your numbers. Next, consider your operational efficiency. Measure your response times for referrals, scheduling accuracy, and visit completion rates. For example, are your starts of care taking place on time and within the required guidelines? Are your phones being answered within the first 3 rings? And are intake forms being completed for follow-up and later measured for your conversion rate? Next, some tools for tracking performance include your electronic health records or your EHRs. Automate reporting on patient progress notes and compliance. Triage your client or patient needs based on these reports. And ensure your progress notes match the care plans. For your sales efforts, make sure that you're using your CRM systems correctly. That's your customer relationship management system. Track your referral sources and engagement. Is your salesperson making the necessary 40 face-to-face visits each week and getting involved in the community that you serve? Or as the administrator, are you handling this task? Either way, ensure that the sales efforts that are being conducted in the field represent what needs to be completed in your area. Next, business intelligence dashboards from subscription software platforms such as scheduling. You can visualize data trends to make informed decisions on next steps. Numbers will always tell you what you need to do next. This could include the number of hours billed for the week, how many claims were submitted, how much top-line revenue was earned, how much payroll is owed to staff for the pay period, what is your current active census count, how many inquiries came in for the week, and how many of those inquiries converted into clients, which is your conversion rate, and anything else that you want to measure. Measuring performance is just the first step. Now, let's discuss how to assess your agency's operations thorough internal audits. So as the administrator, conduct regular internal audit meetings that help you identify compliance gaps, opportunities to improve patient care, and to prevent legal or financial risks. Some areas for you to audit include the following. Please note, though, that you may need to run relevant reports, pull non-electronic files for review, or have everyone logged into their device to follow along in the appropriate reports. So first, clinical documentation, whether that's progress notes or nurses from your therapists, nurses, clinicians in the field. Either way, notes need to be taken at each visit, so you'll ensure that timely, complete, and accurate client or patient records are in fact complete. If you are not a clinical person, review these details with your staff nurse if you have one. This will also be discussed in your QAPI meetings, as mentioned in a previous video. Next, your billing and revenue cycle management. Verify correct coding and other identifying information and timely claims submissions, regardless of whether your agency is skilled or non-skilled. Employee compliance. Check adherence to training, background checks, and licensure requirements. Keep updated employee records and HR files with non-expired licenses, training or certifications, and of course, background checks. None of these items should ever be expired in an HR file. Next, patient safety and quality of care. Review infection control measures and emergency preparedness. Ensure that your emergency plan contact information is updated at all times and conduct annual drills. Next is some steps for conducting an internal audit. First, you'll set clear objectives. Define what you want to evaluate, whether it's compliance, efficiency, financial health, along with client and employee metrics, among other things. Review policies and procedures. Ensure that your ever-changing processes align with state and federal regulations and that all of your staff have been trained accordingly. Next, collect and analyze data. Use your patient records, your financial statements, your meeting minutes, and your employee files, all to make sure that you are identifying trends for the growth and success of your agency. Next, identify gaps and create action plans. Address any deficiencies that may have come up. Those would include having corrective measures for each and assigning tasks to the appropriate employees for handling. Of course, you must monitor and follow up. Reassess after implementing these changes to track improvements and review all progress at your next team meeting. A strong audit process helps maintain compliance, but staying ahead of industry trends and regulations is just as crucial. The home health industry is constantly evolving. Changes in technology, regulations at the federal or the state or even the local level, and patient needs require administrators to be and stay proactive. So next, staying ahead of industry trends. Some examples of this would include, let's say, telehealth and remote monitoring, expanding virtual care services to enhance patient access, maintain an inventory log of any equipment that may have been left in a client's home for their care that your agency paid for. You'll need to have a process in place to retrieve this equipment if a client or patient discharges from the care of your agency. Keep a strong inventory worksheet in place as well. Next, workforce development. Addressing caregiver shortages through training and retention programs will be a critical piece of this puzzle. Also, ensure you have an employee recognition plan in place to help with the reduction of turnover. Next, integrated care coordination. Collaborating with hospitals, physicians, and other referral sources along with other payers will provide for better patient outcomes and agreeing on staff training opportunities. Tailor your training to the needs of the referral source. Next, keeping up with regulatory changes. Monitor CMS and state guidelines. Stay updated on Medicare, Medicaid, and state agency licensing requirements. Number 2, implement compliance training. Regularly educate your staff on new policies and procedures as they arise, as we've mentioned in a previous video. 3, leverage legal and compliance experts. Consult legal professionals. They are always helpful to have on staff or available to be at your disposal when a question comes up that you may not be able to answer from a legal perspective. Being adaptable to industry shifts ensures sustainability, but long-term growth requires strategic planning. A clear strategic plan helps your agency expand, improve efficiency, and remain competitive in the evolving healthcare landscape. Next, we'll look at the components of a strategic plan. First, we'll look at the vision and mission alignment. After you've defined your vision and your mission, define some long-term goals that align with patient-centered care. Offer specialized service programs when you identify these needs in your community. Next, market analysis. Assess your agency with industry trends, competitors, and referral sources, and adapt often. Financial forecasting. Plan for revenue growth, investment needs, adjust your budget as you go throughout the year, and risk management. Make sure your goals are challenging but achievable each year. Overestimating your earnings and your budget can be demotivating to you and your team when you see that you're not reaching those goals that you set forth earlier. Next, workforce planning. Develop strategies to recruit, train, and retain top talent, and do everything you can to be the employer of choice to retain them. Identify who in your office will handle the sales efforts in your organization. Is it you as the administrator, or will you hire a dedicated salesperson? If you are just starting out, you may need to take on this role. Technology and innovation. Invest in electronic health record upgrades, automation, and digital marketing. Ensure the platforms you select are user-friendly for scheduling, billing, or running the reports that you need to monitor your business. Some growth strategies for home health agencies include strengthen your referral partnerships, build stronger face-to-face connections with hospitals, physicians, skilled nursing facilities, assisted and independent living communities, adult daycare and adult care facilities, churches, long-term care insurance providers, elder law attorneys, geriatric care managers, and more. Check out the other video on this YouTube channel entitled Types of Home Health Care Referral Sources, and ask any questions you have about how to approach these referral sources in the comments section. Next, enhance your digital marketing efforts. Use SEO, or search engine optimization, paid ads, word-of-mouth advertising, and social media campaign outlets to attract new clients. Optimize operational efficiency. Always streamline the efforts in your office, including scheduling, billing, and compliance processes. By planning and operating strategically, you can ensure that both short-term success and long-term sustainability are achieved. So that concludes our session on performance metrics, audits, industry adaptation, and strategic planning. Today, we cover key measurable metrics, internal audit meetings, regulatory changes, and sustainable growth strategies. As an administrator, your role is to ensure that your agency remains compliant, efficient, and forward-thinking. By implementing these strategies and more, you can build a stronger, more resilient home health organization and become a leader in your community for both your clients and your employees and your referral sources. So your final step in this process, if you're ready, is to now take the final exam. You will find a link to the exam pinned below in the comment section of this module. All you have to do is click the link. The test consists of 100 questions valued at 1 point each. Once completed, you'll receive a certificate by email if you earn the passing score of 90% or higher. Should you have any questions at all, or any feedback about the videos or the test itself, please ask any of these questions or provide any of these feedbacks in the comments section of any of the videos, and I will do my best to respond to each and every one of them. Wishing you very much success in your home healthcare journey, and I'm here should you need anything at all. All the best.